Hello and welcome to the joint replacement class for Duncan Regional Hospital's Joint Replacement Center. Today we're going to talk about everything you need to know to help you prepare for surgery, to know what's going to happen to you when you're in the hospital, and what's going to be expected of you when you return to your home setting. The members of our healthcare team include a number of people that you're going to have some experience with while you're at the hospital. Starts with me today. My name is Toni and I'm the nurse navigator for this program. You're also going to have therapists and nurses that you see in the hospital. You're going to see nurses and anesthesia technicians in surgery. You're going to have a number of people that you touch throughout your stay, the dietitian possibly. But all of those people will be involved in helping you to achieve the very best outcomes that you can achieve with your joint replacement. No matter which surgeon you have chosen, we have two excellent orthopedic surgeons. Dr. Thomas Iser and Dr. Danny Giles both have been doing orthopedic hip and knee replacements for a number of years. They consistently have excellent outcomes with their surgeries. I like to start class by talking about your surgery, and we're going to start by talking about the knee replacement. Okay, so if you're having a knee replacement, they are going to make an incision down the center of your leg. Once they get underneath the skin, this long tendon holds your kneecap on the back of it. Sometimes that kneecap has to be smoothed if it is arthritic or has any little deformities on it. They may have to smooth that off. If they take enough of the bone off, they can drill a couple of holes in it and cement a button-like object on the back of it to give you some more surface. During surgery, your knee will be bent like this, and this is your meniscus. If you are having a knee replacement, then you probably don't have much meniscus. This is your ACL. If you have an ACL now, you won't have one after surgery, and you'll see as we talk about the implant. The surgeon has chosen about what he thinks you're going to need. Zimmer is the company we use. The Zimmer rep comes in the morning of your surgery. He brings a cart of all of the possibles in. They're going to pull the prosthesis that best suits your needs. It will look something like this. It is going to be some type of metal, possibly stainless steel, possibly titanium, can be a mix of metals. This comes with a guide. They use that guide. They drill a couple of holes in this upper bone, the upper bone of your leg, and they cut 5 perfect planes on that bone. Once those planes are cut, this prosthesis fits like a hand in glove. It can just be tapped into place. It doesn't necessarily require cement to hold that into place. The lower part of the bone, he is going to smooth off whatever bone needs to come off of that. They cut a V down into the bone, and the prosthesis that is going to be on the bottom looks like this. It is the same type of metal that is used on the upper part. It has a flat surface and it has a little V protrusion on the bottom. This also has a polymer insert that serves as the cushion between the two. This is put in with bone cement. The surgeon puts that in place. He removes any excess bone cement, and then they wait for that to dry. And once that is dry, then he pulls those two pieces together. He pulls all those tendons and ligaments and muscles back around where they go. And it's important to understand that piece of it, because after surgery, your leg can feel like it slips. When you first stand up and you're first walking, it can feel like the bones slip on each other, and it can, because your muscles and tendons and ligaments are loose. Therapy is going to get that strengthened, and it's going to get that back in shape so that it works functionally for you. When you take a step, it can even bend back a little bit. The therapist may call that buckling, and that's just because those muscles and tendons are not tight. But again, your physical therapy is going to be what helps you reach the goals to get that back into shape. If you're having a hip replacement, This is what a hip joint looks like. This would be a right hip joint if you were looking anatomically. They're going to make an incision up the side of your leg that comes back towards your buttock just a little bit. The incision typically is shorter than what you would see with a knee replacement. Once they get inside, you can see by the joint that there are muscles that surround that whole joint very tightly. So there is muscle that has to be cut to be able to get into the joint, and that's part of your healing process. Used to, when you had a hip replacement, you had what was called hip precautions that you had to follow. And you may have hip precautions if there's something particular going on with you, but a full hip precaution, you couldn't bend your hip joint beyond a 90-degree angle, you could not cross your legs, and you had to sleep with a wedge between your legs so that you wouldn't accidentally cross your legs while you were sleeping. Surgery techniques have improved such that it's not necessary for most hip replacements to be that precise. What your surgeon may tell you, or what your therapist may tell you, is that your hip precautions are going to be modified, and so you won't do anything after surgery that you couldn't do before surgery until that's completely healed on the inside. When they get inside to the joint, they are going to clean that socket out. The prosthesis for the socket will look something like this. It is metal on the outside. It has a porous outer surface that helps the bone grow to the prosthesis. This has the polymer built into it, so that serves as the cushion between the two. That can be put in with bone cement. It can be put in, and just the pressure of the two pieces together hold that into place until bone begins to grow. For the upper part of your leg, they are going to cut the head off of your femur, and they're going to cut a groove down into that bone. The prosthesis is going to look like this. It is metal on the bottom, it has a ceramic head, and this just sits down into that bone. And then the two of those are put together, and the muscles are repaired, and then the closing's done. Closing of your incision can be done in several different ways. You can have the old-fashioned sutures. We really don't see those anymore. You can have staples that close on the outside of your incision, or you can have internal sutures that self-dissolve with the external dermabond. So if when your dressing first comes off, you see that you don't have any staples or sutures, don't be afraid of that incision popping open, because it is sewn on the inside with self-dissolving sutures, and then the dermabond, the skin glue, is just on the outer surface. Anytime you have surgery, there are some risks. There are things that the surgeon may tell you about that are possible things that can happen. You have put yourself in the hands of an excellent surgeon and an excellent surgical team. So they're going to take care of you in surgery. So we don't want to talk about those risks. I want to talk about risks that you actually can do something to help with. The first one is if you are diabetic, or if you tend to have high blood sugars, it's very important that you maintain a good healthy blood sugar during this period, the preoperative period as you're getting ready for surgery, while you're here at the hospital, and when you go home, to continue to maintain a good healthy blood sugar that helps you to heal faster, and it helps to prevent infections. When your blood sugar is high, you have a bigger chance of getting an infection, and you heal more slowly. If you are not a diabetic, you may have noticed that when your labs are drawn, that an A1C is drawn with that. That is typically a test that is done for diabetics. However, we draw that on all of our patients. We want to see what your A1C is now, and then depending what that is, you may continue to have finger stick blood sugars while you're in the hospital, and you may even get some insulin. When you're not diabetic and your blood sugar and you have surgery that puts your body under stress, And it can make your blood sugar raise even though you're not diabetic. And it can have the same effect on a non-diabetic as it does a diabetic. It can cause you to heal more slowly, and it can increase the chance of infection. So by monitoring your blood sugar while you're here at the hospital, and maybe even giving you some insulin if you need it, then we can help your body to maintain that good healthy blood sugar that will help you heal faster. You're going to have limited range of motion. Hips, because like we talked about earlier, until your muscles heal on the inside, you can't do anything that you couldn't do before surgery. Knees, because even though when you're on the operating table and after surgery they bend and extend that leg to be sure everything's functioning like it should, you're not going to be able to do that after surgery. You're going to have swelling, you're going to have blood that's built up, all those muscles and tendons and ligaments are going to get sore, so you're going to have a very limited range of motion. Again, physical therapy is going to help you reach those goals and get that range of motion back. You're going to have bruising. How much bruising you have really depends on how much you bleed in surgery. It also depends on how easily you bruise now. If you bruise easily now, you may have more bruising. You can have bruising around the incision. You can have bruising on the front and back of your leg. You can have a leg that's black and blue from top to bottom, and all of that is normal. Most typically, you don't see any bruising when the dressing first comes off because the blood is trapped deep in the tissues. But over the next couple of days, it's going to start working its way out to the surface, and the bruises are going to become more visible. So don't be alarmed if a couple of days after you get home, someone says, "Oh my gosh, your leg is all black and blue," because that is all normal. If you're having the knee replacement, you're going to have numbness on the outer part of that knee. The numbness is caused from nerves that are cut in surgery. Sometimes that numbness goes away with time. Sometimes that numbness never goes away. But it's not anything that affects anything that you can do. It is just a sensory numbness, so when you touch the outer part of your leg, you don't sense that touch like you do on the other parts of your leg. I've had patients tell me that their numbness went away after about a year. I've had other patients tell me that it's still there. You're going to have instability because of the stretching and moving of things to get into that joint. So for that reason, everyone that has a hip or knee replaced has to have a walker. So no matter how young you are, you have to have a walker. So if you take a step and the knee or the hip gives a little bit, you have something to stabilize yourself and you don't fall. Falling is the worst thing you can do. If you fall, you're probably not going to do anything to tear that new joint up, but you can break bone around it, and that could cause some real challenges on how do you fix that. Two things that can happen when you have a joint replaced that can be pretty serious. One is infection, and the other is blood clots. So let's talk about those. If you get an infection in a replaced joint, it can mean months of IV antibiotics. If it can't be cleared up, it can mean going in and taking that joint out and then putting an antibiotic block in, and then once the infection is cleared up, going back in and putting a new joint in. So something you don't want to do, and I'll guarantee you it's something your surgeon doesn't want to do. So for that reason, you're going to find that your surgeon is going to be very particular about anything that could possibly cause an infection. So how do you help prevent infections? Number one thing you can do is good hand washing. You need to wash your hands well. You need to wash your hands often. You could need to carry a hand gel with you and wash your hands when you're out in public. When you have been out where other people are, then and other people have touched things, then you need to wash your hands to be sure that you're not picking anything up. Avoid people who are sick. If you have a sick friend or a sick family member or church member, don't go visit them. Give them a call, but stay away from them. If you get sick before surgery, your surgery is likely to be canceled. So stay away from people who are sick. Be careful not to get any cuts, scrapes, or scratches anywhere on your skin. We're not talking just necessarily on that surgical leg. You can have cuts, scrapes, or scratches on your arms or hands that could postpone surgery. Your skin is a barrier. It helps to prevent infection from getting in, and anytime you have a cut or a scrape or a scratch, anything open gives an area where bacteria can get into your skin and could potentially be carried through your bloodstream and to that joint. So we're going to be very careful about that. If something happens to you as you get close to surgery and you have some type of accident where you have a little cut, you can give the nurse navigator, give me a call. We can talk about ways to care for that and to be sure that the surgeon is aware of it so we don't have any surprises when you come in for surgery. Ladies, do not shave your legs for at least 5 days before surgery. That removes the outer layer of surface of skin, and it also gives you a potential of cutting yourself. You need to get an antibacterial soap. You can buy that at any store. It doesn't have to be any particular brand, but just it needs to say antibacterial on the outer package, and use that for bathing for the week before your surgery. Each day, and each time you take a shower, then bathe with your antibacterial soap. I have given you, or you will receive, 2 bottles of Hibiclens. One of these bottles of Hibiclens is to be used the evening before surgery. The other bottle of Hibiclens is to be used the morning of surgery. And the way that you use the Hibiclens, you're going to take a shower as normal. You wash your hair with your regular shampoo through this whole process. Normal shampoo. You can always use whatever you typically use on your face. Then you're going to wash your body with the antibacterial soap that you have been using throughout the week, and you'll rinse completely off. And then use your bottle of Hibiclens and apply it generously to your rag. It won't take the whole bottle, but you apply that to your rag, and then you bathe with it. You're going to spread it from your neck to your toes, not on your privates. Neck to toes, I hear this does not lather. It just kind of slathers on, so slather it all over, everywhere you can reach, particularly on that knee or the hip that's having surgery. The Hibiclens needs to stay on your skin for at least 3 minutes. So you may have to turn the water off and let that Hibiclens sit. But after 3 minutes, then you can rinse the Hibiclens off. And then you towel dry that evening before surgery, wear clean pajamas, sleep in a clean bed, and then the next morning when you get up, you're going to repeat that process over again with the shower. The only difference between the 2 showers is the evening before you can use lotions, creams, or deodorants. The morning of surgery, there's no lotions, no creams, no deodorants. Let's talk about healthy teeth and gums. Everybody at this point preparing for surgery should have healthy teeth and gums. Our mouths have so much bacteria in them that when you have a problem in your mouth, you have a very big potential of getting bacteria in your bloodstream that could go to your joint. So if you have a problem with your teeth, it needs to be taken care of before surgery. If you have to have a tooth pulled, or if you have to have some type of surgery, that is going to have to completely heal before you can have surgery. So talk to your dentist if that is the case. If you need to have your teeth cleaned, you can have your teeth cleaned before surgery. However, you cannot have any elective dental work, teeth cleaning, or any elective dental work for up to 9 to 12 months after surgery. The other thing that you're going to notice that we do for infection control is the morning that you come in for surgery, the nurse is going to bring you 4 swabs that you are going to use to clean your nose, 2 for each nair, and they're going to demonstrate or explain to you how to do that. The purpose of those swabs gets rid of any bacteria that might possibly be in your nose. We have learned that MRSA, MRSA or MSSA. Those are both staph bacteria that live on things. It lives in our community, it lives on surfaces, it can live on your skin. It can live in your nose the same way that it can live on other surfaces. So by cleaning your nose before surgery, it gets rid of that bacteria and decreases the chance of you getting an infection. Okay, I told you that two things that can happen is infections and blood clots. We talked about infections, so let's talk about blood clots. Blood, if you remember back in biology, blood is formed in your bones. So when you break a bone or when you have surgery and cut a bone, it increases the chance of a blood clot. Knee replacements have a pretty high chance of a blood clot for a couple of weeks after surgery, and hip replacements have a high chance of a blood clot for about a month after surgery. So for that reason, there are some things that you can do to help decrease the chance of a blood clot. First thing is by doing the exercises in your book. There are 6 preoperative exercises that at the end of this video, the physical therapist is going to demonstrate for you how to do those exercises properly. It's important that you do those. It's important that you do them twice a day, getting up to surgery. Now, they're not hard exercises. One of the exercises is this. It's just moving your toe back and forth, up and down. That becomes a very important exercise after surgery, because what it does is when you point your toe and move your foot up and down, then it tightens the muscles in your calf. Well, when you think about how blood pumps through your body, your heart pumps blood, it goes through your body. In your feet, there's not really anything down in your legs that is helping blood get back to your heart. You're fighting a little bit against gravity, and as we get older, our blood vessels get a little loose like everything else. So there's not anything that's really helping that pump blood back to your heart. And the blood can slow. That's why most blood clots will start in the lower leg in the calf or in the thigh, because that's where blood's moving the slowest. By doing that ankle pump exercise, it tightens those muscles in your calf, and those tightening of the muscles help to push the blood up back to your heart, so it helps to prevent a blood clot. You're going to wear what we call sequential compression devices, or SCUDs, while you're in the hospital. These are little Velcro, they Velcro around your calves. They have bladders in them that fill with air. They are hooked to a machine at the end of the bed, and the machine will move air into them. And essentially what they'll do is one fills up with air and squeezes your calf, then the other one fills up with air and squeezes your calf. This alternating back and forth to help to prevent blood clots. Each of you will take some type of blood thinner. The blood thinner will be prescribed for you by your physician. If you're taking a blood thinner now, you will more than likely go back on your blood thinner as you are now, following surgery to help to prevent blood clots. If you're not taking a blood thinner now and you do not have a family history of blood clots, and there's no reason to think that you're at any larger risk than the average person is for a blood clot, then your blood thinner may very well be a baby aspirin twice a day. Whichever that is, it's important that you go home and you take that as you're supposed to. If you go home with an aspirin as your blood thinner, it's important that you take it every day at the same time each day, that you're taking it morning and evening for the length of time the surgeon asks you to take it, to help to prevent blood clots. One of the biggest things that can cause a blood clot or encourage a blood clot when you are at home is sitting around. Sitting is not your friend. It's important that you be up and moving around. You've had this surgery. The doctor and the nurses are going to ask you, if they haven't, why do you want to have this joint replaced? Well, I guarantee you, none of you want to have this joint replaced so you can sit around. You want to get back to normal activities. You want to get back to playing with your grandkids. Other complications you can have after surgery, well, one of the biggest one is constipation. A lot of joint replacement patients have problems with constipation. So when you're in the hospital, you're going to be taking a stool softener. Stool softeners, however, do just what the label says. They soften stool, so it pulls more fluid into your bowel and makes your stool softer. It doesn't necessarily help you go more, or it doesn't help you go. So it's important when you get home that you eat the foods you need to eat to help your bowels move. You take laxatives if you need to, but if you have gone more than a day or two beyond your normal schedule, then you need to be taking some kind of action with a laxative to help keep your bowels moving. You don't want to get to the point where you have constipation so bad that you have to come back to the emergency room. It's important to follow all the instructions that you're given when you get home. It starts out today. We're doing lots of teaching today, but while you're in the hospital, the nursing staff and the therapy staff are going to be teaching you constantly. It's important to follow all those instructions. Everything that we're telling you are things that are going to help you be successful with your joint replaced. It's important to continue to maintain that good healthy blood sugar so that you decrease the chance of infection and heal as fast as you can. It's important to be an active participant with your physical therapist after surgery. You're going to have some options once you leave the hospital of having home care physical therapy or going to an outpatient clinic for physical therapy. Whichever you choose, you need to make a commitment to make that yours, because therapy after joint replacement is not necessarily a lot of fun. There is some discomfort that is involved. There is some ways that you can help to decrease the amount of discomfort you have during therapy, and we'll talk about those. But it's important that you make those therapy appointments, that you don't cancel, that you don't postpone. Keep that therapy schedule up and continue to do your exercises twice a day. It's important that you follow all the safety guidelines that we're going to teach you so that you don't have falls. It's important to keep that walker with you. We talked about a fall can be very detrimental to your healing and keep you from reaching the goals you want by giving you a huge setback. If you smoke, we recommend that you stop smoking before surgery. It is really advised that you stop smoking at least 6 weeks before surgery. You will not be able to smoke while you're in the hospital. This is a perfect opportunity to make a change for your life and to have a healthier overall being. But after surgery, smoking can decrease how fast you heal, and so it can kind of play against you. So consider that if you are a smoker. After today, you need to start getting your home ready for after surgery. So what does that mean? Really, it's kind of accident proofing your home. Take a walk around your house and look around and see things that could be a safety hazard. Are there things in the floor that need to be moved? Do you have furniture that needs to be scooted out or scooted back? You might take out a walker if you have one. And if you don't have one, pretend you have a walker. Kind of hold your hands out to your sides and walk through the house and see, can you get the places you need to get? Can you get between the couch and the table? Can you get into the bathroom and start thinking about how you're going to motivate when you have a walker at home? Pick up all the throw rugs in your house. Throw rugs are a tripping hazard all the time, but particularly after you had a joint replacement surgery and you have a leg that's not working quite like it did before, and you have a walker that you're pushing in front of you, it makes it even a bigger tripping hazard. So pick those up, put those up, leave them up until after this is all healed. Have a plan for your pets. Who's going to help feed them and put them in and put them out? Start thinking about those things. If you don't have night lights up, put night lights up so that you have some light when you get up in the night and there's not any chance of you having an accident. Plan which chair you're going to use. A recliner makes a perfect chair for doing your exercises in. You'll see that when you're in the Joint Replacement Center, you have a recliner that is yours. It goes to therapy with you. You can do many of your exercises in that recliner or standing in front of the recliner. If you don't have a recliner, you don't have to get one. Any chair will do. Any chair that has arms that does not roll, you can use another chair or an ottoman or a table in front of you to do the extended leg exercises. If you live alone, you need to plan for who's going to stay with you for a few days. Typically, your hospital stay is going to be 1 to 2 nights. Count on one night and then plan for what you're going to do when you get home, so that you have someone there with you for a few days. You're going to need someone for longer than a few days to check in on you and help you with the things that require you to take your hands off the walker. Many of you now live day to day with a disability, with a leg that's not functioning like it should. So it may not be much different after surgery. The difference will be that we're going to ask you to keep that walker in front of you so that you don't have any accidents. So have some arrangements to have somebody help you with things that require you to take your hands off the walker. Okay, so you need to pack for your stay. What do you need to pack? You need comfortable, loose-fitting clothes that you can exercise in. They can be pants, they can be shorts, t-shirts. You might, if you tend to be cold, you might bring a little jacket or a sweater to wear over your t-shirt. Tennis shoes are a perfect shoe to do your exercises in and walk in the halls of the hospital. If you don't have tennis shoes, any shoe that your foot fits into, not a flip-flop type shoe, but any shoe that your foot fits into. And I recommend one that ties or has some kind of strap that you can loosen if your foot's swollen. You need shorts or underwear that you can put on the day of surgery. When you come out of surgery, you're going to have your hospital gown on, and everybody wants something under that. We all know that the hospital gowns flap in the back, so something under that hospital gown when you first start to move around after surgery. If you wear glasses or you have dentures or you have hearing aids, bring something to put those in so that when they come off of your body, they go into something that is safe and it doesn't accidentally get knocked off into the trash or carried off with your food tray. If you wear a CPAP or a BiPAP, bring that with you so that you oxygenate well and sleep well. And I recommend you bring some pajamas or something to change out of your exercise clothes into to sleep at night. If you would like to bring a pillow, your favorite pillow, feel free to bring that, but put it in a pillowcase that's not white. So 1 week before surgery, you need to begin washing with your antibacterial soap. If you drink alcohol, you need to reduce your alcohol consumption. Alcohol thins your blood a little bit, so kind of watch that for the week before surgery. When we review your medications, we're going to talk, if you take a blood thinner, we're going to talk about when to stop that specifically. But the week before surgery, you need to also stop taking any over-the-counter aspirin, Motrin, Aleve, ibuprofen, anything like that. They all thin your blood. The only over-the-counter medication you can take the week before surgery is Tylenol. So if you need something, look at the label, be sure it's Tylenol based or is Tylenol and not one of the other products. The day before surgery, when we review your medications, we will talk to you about taking Tylenol the day before surgery. It's recommended that you take 1,000 milligrams of Tylenol in the morning and 1,000 milligrams of Tylenol that evening. That's 2 extra strength Tylenol in the morning, 2 extra strength Tylenol before you go to bed. There are studies that show that Tylenol taken the day before surgery actually helps with after surgery pain. So does it work? I don't know, but it won't hurt anything. You're going to shower with your Hibiclens, as we talked about earlier. Remember the instructions for your diabetic medications. That's very important. There are some diabetic medications that if you accidentally take beyond the time that you've been instructed to stop those, surgery will be postponed because it can be dangerous for you. You're going to get a call from the nurse navigator the day before surgery, and my question is going to be, how are you feeling, and do you have any cuts, scrapes, or scratches that I need to let your surgeon know about? The hope is that if something has happened, that we can either get you in to see someone in the surgeon's office, or maybe get a picture of that so we can have the surgeon take a look at it before you actually arrive and hopefully don't get here and then get sent home. The surgery department is going to call you that same day. They're going to tell you what time to stop eating and drinking. They're also going to tell you what time to arrive at the hospital. The day of surgery, you're going to shower with your Hibiclens. Remember, no lotions, no creams or deodorants that day, nothing on your skin. You can put lotion on your face if you want to, but nowhere else. You're going to wear comfortable clothes to the hospital. I recommend just go ahead and wear your exercise outfit that you're going to bring to the hospital with you because you won't be here long before they have you change into a hospital gown. Take any medications that we have instructed you to take when we went over your medications with you with a little sip of water. And we will have provided you with a bottle of Gatorade with a label on it. The label says drink the contents of the bottle 2 hours before your scheduled arrival time. So if surgery tells you to be here at 8 o'clock, then you're supposed to drink this Gatorade at 6 o'clock, so 2 hours before your arrival time. The purpose for the Gatorade is that it helps you be more hydrated when you come in for surgery. It makes starting your IV easier, and it also helps to decrease nausea that might come after surgery. You're going to arrive at the hospital at your scheduled arrival time. You'll go to the outpatient surgery area. If you're not sure where that's at, it's on the southwest corner of Duncan Regional Hospital. When you arrive, you're going to get checked in. You're going to get moved to a room in the back. They're going to start your IV. They're going to ask you all of the questions and go through everything that they do to get you ready for surgery. While you're in the back, a member of anesthesia team and your surgeon is going to come visit you. It's a perfect time to ask your surgeon any last minute questions about the surgery, and perfect time to let anesthesia know. If you have had surgery before and had any problems, let them know what problems you've had. There's things they can do to help prevent those from happening again. Knee patients typically have, and I say typically because the type of anesthesia that you're going to get is going to be tailored to meet your needs, but most typically what we see is for knees and hips both, they get an IV and they get propofol and Versed in their IV. Those are both kind of twilight medications. They put you under for surgery, but they don't put you completely out where you're not breathing for yourself. So that's Versed and propofol. Knees typically get a spinal that numbs you from the waist down, and then you'll also get what's called an adductor canal block. It's a block that's put in down close to your knee on the inner side of your thigh. It gives you pain control medication in that knee capsule that lasts for 24 to 72 hours. So it's working for you after you go home. Hips may get a spinal, or you may have general anesthesia. It depends on your surgeon's preference and what your particular needs are. Surgery time is approximately 2 hours. Of course, there's many things that happens before you actually go in surgery, so be sure and tell your family that you're going to be back there longer than 2 hours and not to worry. After your surgery, you'll go to the recovery room and you'll be in recovery anywhere from 30 minutes to an hour, and then you'll come up to the 3rd floor, the Joint Replacement Center. When you first wake up from surgery, you're going to have an oxygen mask over your face. It's a full covers your mouth and your nose. It's called 100% non-rebreather mask. It has a bag at the bottom of it. Everyone who has surgery gets that after surgery. You have high flow oxygen. High flow oxygen after surgery for 2 hours helps you to heal faster. When you get to the floor, we're going to put a nasal cannula in your nose. It can hook to oxygen later if it needs to. However, it hooks to a machine that is called a carbon dioxide monitor. And what that monitors is how many times a minute you breathe and how much carbon dioxide you're putting out. So it helps the nurse to monitor you through the night when you've had anesthesia and medications that maybe you haven't had in the past. You're going to have at your request dining. You have a menu in your room. You choose which foods you want and you eat when you would like, so it's a very nice setup. They're open from 7 in the morning to 7 at night. Your family, if they're here with you, can also eat off the menu for $6. You'll have pain medicine as you need it. Now, if you have a spinal, you may have a temporary time that you have what's called incontinence. That's where you can't control your bladder and you may have a little bit of urine leakage. That's caused because the spinal numbs you from the waist down and you can't fill your bladder. But your bladder, you're getting IV fluids and your bladder can begin to get full and you can have some overflow urine. So don't stress out about that. The nurses expect it. When you arrive to the floor, then they will take care of protecting you until that numbness goes away. If you have a knee replacement, you may have some pain around the top of your thigh that's caused from the tourniquet that they use to block the blood flow into your leg. So you may even have some bruising up there, and that would be normal. You will be doing some deep breathing and coughing exercises, and you'll be using your incentive spirometer. You'll have ice on your leg pretty much constantly when you're not up and about to help reduce swelling and inflammation. If you've had a knee replacement, the following morning after surgery, they're going to change your dressing. You'll come out of surgery with kind of a bulky dressing on. You're going to have cotton wrapped up your leg and then a big ACE wrap over that. All of that will come off and this dressing will be applied. If you have hip surgery, that you come out of surgery with this dressing on. It's a smaller version of the knee AquaSeal. Both of these dressings are wonderful. They are silver impregnated, so they help fight bacteria. They're very pliable and comfortable and sticky. They are waterproof, so you can, with the dressing on, you can take a shower. You don't have to cover it to be able to take a shower. Once you get home and it's time for the dressing to come off, there is a trick to getting the dressing off. You get a little pinch of the dressing and you pull directly out on it and it breaks the seal. You'll walk around the dressing, pulling and breaking the seal, and then the dressing will come off very easily. This dressing stays on for 5 to 7 days after you go home, and you don't have to change your dressings. Physical therapy will evaluate you the day of your surgery. Our goal is that you are out of the bed and up and moving around at least a little bit as soon as possible after your surgery. The key to recovery is early mobility, so we want to get you up and moving as quickly as we can. The next day, you're going to continue with some of the same stuff. You're going to do your incentive spirometer. You're going to have ice on your knee when you're not up and around, pain medicine, and then that afternoon you may be going home. Therapy will see you in the morning and in the afternoon the day after your surgery, and then they will help determine if you're ready to go home at that time. Managing pain is very important. We'll be using the scale of 0 to 10 while you're here. 0 is no pain at all, and 10 is the worst pain you can imagine. So somewhere in there, you'll give us your number. There's not anything special about a number. It just helps us to understand, did ice help? Did one pain medicine help better than the other? It helps us to learn how to manage your pain better, and will help you to learn what works and what helps and measures you can use when you return home. Managing swelling is going to be very important when you get home, because when your leg gets swollen, it's going to cause you more discomfort and it's going to make it uncomfortable to do your exercises. So the picture you see is a visual of how to best elevate your leg. Lay flat on a couch or on your bed and elevate your leg up so that your knee and your ankle are about the level of your heart. Doing that 2 to 3 times a day for 20 to 30 minutes in conjunction with your activity and exercises should help you maintain a balance and keep your swelling under control. Safety is important, so while you're here at the Joint Replacement Center, we're going to ask that you don't get out of bed by yourself Every time you get out of bed, we're going to put a gait belt on you. That is a belt that goes around your upper waist. It gives us something to hold on to should you start to feel weak or feel like you're going to pass out. If you have a walker, bring it to the hospital with you. And if you don't have a walker, then we will get the prescription and get that taken care of before you leave, so that when you leave, you have a walker that goes home with you. You will always have your walker in front of you when you get up. So the nurses and the therapy team here are very attentive and will be there to help you each time you are getting out of your bed. We know when you're ready to go home because you're getting in and out of bed by yourself. You're able to dress and put your shoes and socks on. You're getting up and down from the chair in the toilet. You will have had a shower and have done that safely. You will be walking up and down the hall and be able to do that safely. And you'll be able to perform your exercise routine with the help of your coach. When you're discharged, you'll have a prescription for pain medicine. That's going to be the medication that worked best for you while you were in the hospital. You'll have orders for a blood thinner. And it'll either be a prescription blood thinner or it may be aspirin, 81 milligrams twice a day. You'll have written instructions from the surgeon, and you'll know when you're going back to see him. We'll have that appointment set up for you. You'll know when you're starting physical therapy. Are you going to be going to physical therapy, or is physical therapy going to be coming to your home? All of that will be worked out, and those arrangements will be made before you leave the hospital. The week after you get home, I will give you a call and check on you. I have some questions that I ask just to see if things are going okay. But you have my number, and it'll be on your discharge papers. So if you have any questions during this time, you give me a call, and we'll either get the questions answered or we'll get you to the person that can answer it. You'll take your ice packs home with you and your incentive spirometer home with you to use while you're recovering. If you're wondering how long till I can drive, if you're having right leg surgery, it's going to be 6 to 8 weeks. If you're having left leg surgery, it's going to be 4 to 6 weeks. Part of that time is going to depend on if you're still needing to take pain medication. As long as you're taking pain medication, it's illegal for you to drive. Keys to recovery once you go home. Do not sit around. Sitting is not your friend. Be active, be up and about. Do not drive a car until you're cleared to do so. Do not immerse your leg in water. You can't take a tub bath, get in a swimming pool, or a hot tub until that incision is completely healed. Participate with your physical therapy. Make that yours. That is your key to recovery. Your physical therapist, even though your therapy may not be comfortable, your physical therapist is your best friend and going to help you reach those goals that you want and reach those goals that you set for having this surgery. Take walks. Increase the distance as you're able to. Walks are a wonderful way to exercise. Remember to do your ankle pumps throughout the day so that you're keeping your blood pumping. Take a warm shower before you go to physical therapy. Certainly take your medication before you go to physical therapy, and then use ice after physical therapy. Those things will help make physical therapy more tolerable. Full recovery takes time and effort. It takes about a year for a joint that's been replaced to feel natural to you. However, it'll just within a few weeks, you will have less pain, you'll be more mobile, and you'll begin to reach those goals that you set for having this surgery. Thank you.